Dry eye syndrome is affecting more and more people who are experiencing dry, stinging, red eyes. I'm Dr. Neil Renaud. I'm a developmental optometrist, and I'm going to break down how dry eye syndrome works, how it's affecting you, and what you can do to correct it. Before we get started, I want to invite you to subscribe to our other platforms to make it easier for you to find out more information about vision, eye health, and vision therapy. Okay, let's get started. Dry eye symptoms are some of the most common symptoms that optometrists see when they're evaluating eye health. Patient can struggle with dryness where it stings, it can burn, their eyes can tear a lot, they can get red, and even when it's severe, they can even cause blurry vision where they cannot quite see 20/20 anymore. Their vision's always a little hazy or not quite right. So those are some common symptoms. Dry eyes happen on the cornea, the very front of your eyes. Think of like a windshield, and that windshield, everything that we're looking at in the world, we are looking at things out far away in the air, and then as that light enters our eyes, it actually goes from air into water. Your eyes are just full of water basically. So that's the first interchange of air into water, and if we don't have a perfectly wet, lubricated cornea, then we're going to struggle with dryness, with symptoms, as well as poor vision. Because unpleasant and uncomfortable eyes can really mess with everything you're doing. It can be something you're constantly thinking about, so hard to tune out, and people who struggle with dry eyes are looking for answers. Hopefully these are some helpful tools for you. One problem is from lack of humidity. If you're in your workplace or your home, in your car, you're getting a very dry environment, especially in the winters in Michigan. That's when dryness can become a bigger problem. Also, airflow can be a problem when we have fans blowing in our faces. We have overhead fans when we're sleeping. In your car, you've got the vents blasting on your eyes. You're getting a lot of airflow that can actually dry out that surface of your eyes that should be nice and wet. There should be a nice wet layer over the front of your eyes that dries out if you're blowing air on it constantly. The big one is staring at a screen. Did you know you actually blink much less when you're looking at your phone or your tablet or your computer or your television? We just tend to blink a lot less. We are so focused on what we're watching, our eyes have less reflex to close and open and lubricate that surface. Every time we blink, we're spreading tears around. And if we're not blinking enough, then while the eyes stay wide open, that layer of fluid on your eyes that slowly evaporates and dries away. So every time we blink, that's a good thing. When we don't blink enough, dry eye symptoms increase. As virtual learning picked up this year, as Zoom meetings and working from home, everything over the computer increased, dry eye also has increased in this last year. The most common type of dry eyes is evaporative dry eyes, and that is where there are oil glands on the surface of your eyelids, right at the base of each eyelash, that secrete oil onto your cornea, out onto that tear film. It sends oil out to the wet cornea of your eye, the surface of your eyes. And when you don't get enough oil, because those glands actually get clogged up sometimes, then we don't have enough oil protecting the lubrication, the water that's on the front of your eyes. So picture like a bucket of water, and if you pour oil in it, the oil is going to rest on top. That is exactly what we need on the front of your eyes. You need your cornea and then a very wet water layer, and then over the top of that you need a nice oil layer that holds in the water. Without oil, we lose water, it evaporates. So replenishing the oil supply on the outer cover of your cornea actually will help maintain the water on your eyes and avoid them from evaporating out into the air. The ways you can try to fix that are hold a warm washcloth over your eyes with just some warm, not hot water for about a minute or so, and then gently rub your eyelids, kind of massage that loose oil out. So you've just broken down those clogged glands, and then you're releasing some fluid out. When you get dry eye, you also should definitely see your optometrist, who can talk you through the ocular massage and warm compress. Along with, they can recommend different eye drops. I personally, my favorite eye drops are Sustain Balance and Refresh Optive Advanced. These are nice, easy artificial tears that you can get over the counter in the drugstore, and they're safe, they're easy to use, and for lots of cases they can solve all your problems. Over the counter eye drops, Refresh Optive Advanced and Sustain Balance, you can use those. I suggest up to 4 times a day, being really aggressive with them for a few weeks to see if you make progress. And think of if your lawn, the grass in your lawn died, and it's all brown and it's just dead. You gotta water it a lot. You gotta lubricate excessively over and over and over for a few weeks before you get it back to green. Then you can slow down and just maintain. You don't need to water your lawn nearly as much once it's green. Your eyes are really similar. If they're dry, you need to work aggressively a few drops a day for an extended period to try to get your ocular surface nice and lubricated consistently again. And then once you've done that and you don't have those same blurry vision or irritation symptoms anymore, then you can start tapering off and slowing down how much you use those drops down to just kind of an as needed kind of thing. One thing I would not suggest doing is getting redness relief drops like Visine or Clear Eyes. Those have different purposes than dryness. So there actually can be a rebound effect where if you use Visine, you may feel better for a few minutes, for an hour or so, but then you'll go back to being dry and maybe even drier than before, and you want those drops over and over. Don't worry about the redness part. If you have dry eyes, you need to get lubricating eye drops. Make sure the box says lubricating on it. That will help replenish the lubrication on your tear film on the front of your eyes so that they don't sting, they don't get red, and you can see clearly again. To combat the leading factors causing your dry eyes, you can invest in a humidifier, and you can put it in the areas of your house that you are most symptomatic, like in your bedroom or the living room, or maybe put it in your office at work. Wherever your eyes are in the driest environment, have it there. If you sleep with a fan in the room, if you have a fan overhead or a fan pointing directly at you, if you drive a lot and you've got those air vents pointing at you, try to point them towards the core of your body or just away from your face so that they're not, just blasting air onto your eyes over and over for hours, drying out the surface of your eyes. Try taking visual breaks from screen time. Every 20 minutes, for 20 seconds, you should look at least 20 feet away. 20-20-20. That's our 20-20-20 rule we talk about all the time in our practice. When you are spending extended periods of time on that screen and you're not blinking enough, get up, go to the bathroom, go look out the window, move your body around. While you're at it, blink a bunch. Catch up on your blinks because you know you haven't been blinking enough on the screen. And then look into those lubricating eye drops and check with your optometrist with what they would recommend would be best for your case. While there may be a rise in dry eye, this is something that you can control. With the right education, seeing your doctor, you can control and manage dry eyes and make it much less of a problem in your life. But your optometrist can make a recommendation as well based on what they see on your eyes when they examine with their microscope. Also, there are much more aggressive treatments out there than just over-the-counter eye drops. I usually start there because that can help almost every patient that I see. But the patients who are still very symptomatic with dry eyes, then I suggest they see a dry eye specialist who can walk through the most advanced technology for dry eyes. And remember, everything in this video is kind of the basics. These are things that you can do right now, right away, to get your eyes feeling better, less irritated, less runny, and clearer. If it doesn't help you as much as you'd like, there are more aggressive treatment options out there. There's tons of dry eye specialists that you can look into and find one in your area who can help you even more than just the standard approaches. But get started there. You may find that you're feeling better right away. Thank you for watching this video. If you have other ideas or questions, make sure to throw them in the comments, and we'd love to hear from you.